If it passes the state Senate, Assembly Bill 2198 will require 15 hours of suicide prevention training for new mental health professionals. Just 2 years ago, the number of suicide deaths in San Diego County reached its highest rate in 24 years. Here to talk about suicide and prevention efforts underway are suicide prevention consultant Stan Collins and Sdsu psychologist Liz Kingsbury. Welcome.
Thanks for having us.
Stan, I think a lot of people were surprised that suicide prevention training specifically isn't already a requirement of therapists, social workers, psychologists, psychiatrists. How do you think this bill will change things if it passes the Senate?
You know, I can't speak specifically, not being familiar with all the provisions of the bill, and I don't think it's to say that none of the curriculums that train any of those professions have that information. I think it's more the important part is to focus on how important it is to continually keep up and refresh those skills. It's a very perishable skill, and there's so much new research constantly coming out that I think mental health providers, physical primary care providers, I think it's important for many individuals to have that information.
And I want to put this into context for people. County Health and Human Services did a report, and they found that in 2012, nearly half of all unintentional deaths in the county, or 411 people, committed suicide, while the homicide rate was 110. And looking at all these numbers, Liz, how prevalent is suicide among college-age people and college students?
It's estimated that in the last year, 1,100 college students died by suicide. But we know that the majority of those students don't ever make it to the college counseling center. And in another nationwide study, we found that 18% of undergraduate students had endorsed thoughts of suicide at some point in the past.
And this is, of course, nationally, but you do deal with it locally here. What do you do as far as trying to prevent that on campus?
We really try to take a comprehensive approach on campus in terms of getting the entire community involved in preventing suicide, keeping in mind that so few of those students actually make it to the college counseling center. So we do training for faculty, staff, and students on campus in recognizing signs and symptoms of suicide in ways to intervene. We also do a number of outreaches on campus to educate our students on signs of suicide, on how to reach out to one another, and things like that.
Okay, and Stan, you actually link mental health issues to suicide. What is the link there?
Well, the research shows that about 90% of people who die by suicide have a diagnosable mental illness, but the key word there is diagnosable, not diagnosed. Unfortunately, people still hesitate to seek help for mental health, not necessarily thinking of their brain as an organ and maybe the most important organ of their body. We ask people, are you physically fit? And I think it's important if we ask folks, are you mentally fit? Because, you know, mental health is so much more than not having a mental illness. It's how do you deal with the daily stresses of life.
What are you seeing as far as stigma, Stan? Are you seeing that is decreasing or staying the same, or is it still playing an important role?
I think stigma is still, it's still prominent and it's still bigger than we would like to see it. But I think through all the efforts, whether it's through Each Mind Matters statewide up to us here in San Diego, I think that we're going a long way to reducing that stigma. But I think we still have a long way to go to get people to understand that not only is help available, but that treatment is effective.
And Liz, what should you do if you think that somebody you know is going to commit suicide or said they might, or they're thinking about it?
Absolutely say something. Start a conversation, let them know that you're concerned, ask them what they're thinking, and get them connected with resources. Stan mentioned a few of them. We've got a San Diego Access and Crisis line. It's Up to Us in San Diego has a lot of resources. So just a conversation in and of itself can instill hope in somebody that things might change and get better for them. Just knowing that somebody cares.
And Stan, you've said actually this is a community effort. What do you mean by that?
Absolutely. I mean, the same way that we say it takes a village to raise a child, it takes a village to save a life. You know, suicide prevention doesn't always happen with a mental health professional. It happens with friends and family, recognizing the signs, asking them, are you thinking about suicide? You know, one of the key factors in suicide is hopelessness. And hopelessness is not a scientific term. It's something that's very much about connectedness to other individuals, saying that I'm going to be here for you, that I want you to be here tomorrow.
And just to dispel, just be very clear, asking somebody about this doesn't cause it. That's a myth.
Absolutely. And research has shown numerous times that talking about suicide actually reduces ideation or reduces thoughts of suicide. So I think it's important to everyone to get educated, to get trained, and to be comfortable asking. The worst thing you can do is say nothing, and if you can't ask that question, find somebody who can.
All right, I want to let folks know that we have suicide resources on our website, phone numbers and links, and prevention tips on kpbs.org. Liz Kingsbury and Stan Collins, thanks very much.
Thank you very much.
Thank you.